Hello there. I'm Dr. Ann Truong. I'm here today with Dr. John Ferrell, and he is the co-founder of ROSM in all over DC, Maryland, but that's soon to be probably national as well, if not all the way to the East Coast. Been also a long time friend of mine and a dear colleague, and he's also my doctor as well. So I'm very picky who I go to see, and he's been my doctor the last few years and fixing me for all my musculoskeletal injuries all over my body. So I'm glad to have him here today. And today we're going to talk about the gold that he is going to deliver at the AAOM conference. It's going to happen on March 13 to 16 in Pensacola, Florida. And for those of you, the docs or providers that are thinking about getting into musculoskeletal medicine, especially regenerative medicine, including platelet-rich plasma, bone marrow concentrate, or microfat or MFAT, this is the one to go to because Dr. Ferrell is going to talk about all those particular aspects. So he's going to do one workshop and two lectures. So the first one is going to be ultrasound guided tenotomy. So, John, what are they going to get? What the attendees going to get by attending this workshop?
Well, first of all, Ann, thanks for having me. I'm excited to be here. Not only do I consider you a friend, but also a mentor. So I'm really happy that you're doing this and you're happy to get some more information out on AAOM, which is going to be a really great conference down there in Pensacola. So it's going to be warm. It's going to be a lot of great teaching. And we think that this is really an opportunity for people, if you're fresh out of fellowship, just wanting to get into it. If you've been in practice for a while, you've heard about regenerative medicine, you don't know a lot about it, this is a great opportunity for you to kind of learn. But also for the people that are a little bit longer in the tooth, who've been doing this for a while, we're going to have some of the latest and greatest data that's out there in regenerative medicine. This is how you stay up to date on it. This is how you make sure you're not left behind and that you're giving the best care out to all of your patients.
Absolutely. So that's why you should attend this year. And this year is going to be jam-packed of value. So what particular they're going to get for the ultrasound workshop?
Yeah, so we're going to do ultrasound guided tenotomy. This is something that, historically was only surgical, right? They would have to cut someone open in order to get rid of chronic tendinopathy. But over the last 10 years, we've been doing a lot of ultrasound guided tenotomy to get rid of either chronic tendinosis, to get rid of bone spurs. Think of, chronic tennis elbow. You think of bone spurs in the plantar fascia or the Achilles tendon. This is a great tool to teach you how to go after these bone spurs, this chronic tendinopathy. If you have ultrasound skills, then you are the people that should be using this tool. And so we will have cadavers down there. We will have a wet lab. We will have a lecture. We will talk about what are the indications, who are good candidates, who are bad candidates, what are risks as you decide to go down and start to kind of use this. And then we'll have fun doing a hands-on lab. We'll have the ultrasound there. We'll have the reps and we will do the ultrasound guided tenotomy. You'll get a chance to get your hands dirty and really see what it's actually like to go through tendon and tissue to see what it's like to feel of it. We'll probably find a couple of bone spurs to kind of go after also. So this is really a great hands-on pre-workshop before the actual conference starts. And it's a great opportunity to get your hands dirty. If you haven't done it, or if you haven't done it in a while, you just need a refresher course, this is a perfect opportunity to get that refresher and to get really comfortable with it.
3-hour workshop. So you get a chance to ask all your questions with the instructor there as well too. I always enjoy the workshop, and just attending the workshop will pay for the conference as well with the knowledge that you get and the hands-on skills that you get if you're interested in doing ultrasound guided tenotomy. So you have two other lectures. The second one is update on orthobiologics, discussing the latest data on platelet-rich plasma, bone marrow concentrate, and microfat. So can you tell us what the attendee gonna get by attending these lectures?
Well, if you're new to regenerative medicine, it's going to be like drinking water through a fire hose. I'm coming at you with a lot of data fast and hard because I only have a very short amount of time to cover three huge topics. We're going to talk about what the data says, what has level 1 evidence for PRP, what is the level of evidence for bone marrow aspirate concentrate, what is the level of evidence for MFAT. And you and I have gone to these conferences for a long period of time. We've seen a lot of new people come through. One of the biggest issues or complaints is, I hear all this good data, but I don't know where to use it. Do I use this on mild arthritis? Do I use this in severe? How many times do I do that? So we're also going to give you some tips on when and how to use each one of these products, how I use it in my clinical practice. And so, good guidelines that you can actually take home and start to implement once you get home from this conference.
Absolutely. What I find that after you're starting out in musculoskeletal medicine or even in regenerative medicine, you know about these skills, but you're like, how do I use it for what indication? And as you know, every patient different. So you got to get some guidelines on who to use it for. And the main thing is get it from the people that knows what they're doing, the expert that's going to be there to show you at AAOM. And your third talk is on subchondral injection, the latest and greatest. You're going to discuss about either doing subchondral or interosseous injection and or plus intra-articular injection. So tell us what your talk is going to be about.
Well, we also want to have something for the more seasoned docs. And, this is probably the hottest topic in regenerative medicine right now is subchondral should we be treating? And, whether or not you're ordering MRIs and you're actually looking for subchondral edema. And, spoiler alert, if you're not, you should be. So if you really want to know what is the data on treating subchondral, why is it the latest and greatest? This is going to explain and kind of walk you through why we should be looking for subchondral edema, why we probably should be treating subchondral edema, and what the literature says to support that.
Absolutely. And also know that he does it himself. So he's just not teaching you. He's also get his hands dirty and doing this every day. And so are his partners as well too. So having said that, what have you find about AAOM and why is it your must go to conference every year?
Yeah, so I think my first AAOM conference was probably about 13 or 14 years ago. And when I went to that conference, I kind of felt like this was home. And especially after I finished fellowship and I continued to go to some of the other bigger name conferences, I felt like they weren't teaching regenerative medicine. I'm like, this is not what I do day in and day out in my clinic. When I came to AAOM, they were speaking my language. This is what I do on a daily basis is high level regenerative medicine that's evidence based. And that's what you get at AAOM. And that's why this is my academic home.
Wonderful. And I feel the same way too. And it's actually my first regenerative medicine conference that I've ever been to, even before I started doing PRP. And it's the go-to conference I go to every year. And that's where I made a lot of friends, you and a lot of our colleagues that we'll be seeing there as well. So having said that, the AAOM conference is on March 13 to 16 in Pensacola, Florida. You get to meet Dr. Ferrell, come and say hello to us as well too. I'll be doing a talk on regenerative medicine for sexuality as well as marketing your practice. So we hope to see you there. Check the link down below here. Find out a little bit about John Ferrell, and we hope to see you in Pensacola, Florida.
Look to see you there.